And in efforts to curb the spread of m-pox in Kenya, the Ministry of Health has announced the imminent rollout of vaccination across 13 counties, targeting the most vulnerable populations. This comes after the country received its first batch of 10,700 doses through a joint effort with several development partners. Brenda Nyongesa now details.
The Ministry of Health has announced that the country will begin the distribution of m-pox vaccines in the coming days. This follows the arrival of the first batch of 10,700 doses secured through the collective efforts of the Kenyan government and the development partners. Speaking at the Jomo Kenyatta International Airport earlier this morning, Public Health and Professional Standards Principal Secretary Mary Muthoni emphasized that the vaccines are a critical tool in reducing the transmission of the virus.
The decision to introduce the m-pox vaccine was informed by the worrying rise of m-pox case over the last few months. As of today, the number of cases has doubled from 32 reported in December 2024 to 68 confirmed cases across the country. And these cases have been reported in 13 counties.
Development partners, including the America Center of Disease Control and Prevention and AMREF, are actively working to ensure that those most at risk, including people living with HIV, are vaccinated first.
Careful planning at this point is paramount to make sure that the vaccines get to the people who are most at risk and who need it most, including those people who are living with HIV.
These 10,700 doses are finally reaching Kenya. It's a first delivery, but it's a first moment that adds one more weapon to our collective fight against this disease.
M-pox is zoonotic, and this is a reminder that human health is tied to animals and the environment. A request and an urge to all of us to adopt the One Health approach.
Lucy Mazawa, Director of Eastern Africa CDC, also reaffirmed the agency's commitment to supporting Kenya's effort to reduce m-pox transmission and ultimately eliminate the disease from the country.
With this allocation, Kenya joins other countries such as Democratic Republic of Congo and Rwanda that have already started m-pox vaccinations. Strong vaccination and successfully doing it requires strong community awareness, adequate resources, and a coordinated response from all the stakeholders. Vaccination is one of the most important tools in disease prevention and control, but it must be part of a broader strategy.
With continued planning and collaboration, there is hope that the m-pox crisis in Kenya can be mitigated, keeping the virus at bay and protecting the public. Brenda Nyongesa, KUTV.